everyone, so let's move towards our today's topic, which is
rectus sheath. Now we have already discussed that anterior abdominal wall. In anterior abdominal wall, the outermost thing is skin, then after deep to the skin superficial fascia, or then obviously deep membranous fascia, then after deep membranous fascia muscles are present, and after muscles rectus sheath and muscles and rectus sheath are present, and after muscles and rectus sheath fascia transferalis is present, and after that the peritoneum is present, the peritoneal cavity is present, in which the viscera, organs, stomach, esophagus is present. Okay, now in this lecture we will gonna talk about rectus sheath. We have already discussed about the muscles of the anterior abdominal wall, so it will be easy to memorize rectus sheath after watching that lecture. So before this lecture, you have to listen the muscles of the anterior abdominal wall, and if you watch that lecture, you will easily memorize this lecture, that is rectus sheath. Now rectus sheath, as you know that in anterior abdominal wall the muscle is rectus abdominalis, and this rectus abdominis is basically hota ye hai ki it is present vertically, okay, on each side of the linea alba, and the medial wall is attached with the linea alba, and the lateral wall is attached with the linea semilunaris. Okay, so those vertical muscles are covered by a sheet, and that sheet is basically a rectus sheet. Okay, now rectus sheet is fibrous layer, okay, and strong fibrous layer होती है जो like I said rectus abdominis muscle के ऊपर होती है. Now anteriorly all the muscles, okay, anteriorly means towards the skin, so towards the skin the rectus sheath is covered with all the muscles. And if I talk about posteriorly, so posteriorly it is divided into three parts. The upper part which is near the costal margin, so obviously the upper part of the posterior wall of the rectus sheath is formed by costal margin. The middle part, the second region, consists of aponeurosis of external oblique muscle, and the lower part, the third part till the pubic symphysis, will consist of fascia transferalis. We will discuss about fascia transferalis in the separate lecture. Now contents, what are the contents of the rectus sheath? Okay, this is very important topic because contents are very important. So what are contents? Contents are basically rectus abdominis muscle, obviously superior and inferior epigastric artery, and all the nerves which are supplying the anterior abdominal wall, and those nerves are L1 and T7 till T12 nerve. Okay, T7 till T12 nerve which are thoracic nerve, and L1 nerve which is lumbar nerve. These all nerves are present, and you have to remember the name as well, that obviously T7 till T12 T7 till T11 intercostal nerve होती हैं, then T12 को subcostal nerve कहते हैं. L1 दो nerves arise करता है, that is ilioinguinal and iliohypogastric nerve. So you have to know that. So this was the whole topic regarding rectus sheath. Till then, work hard and study hard, and good luck. Take care. Bye bye. Thank you.